Department of Health and Human Services has been criticized for months for giving big promotions to Governor McCrory's campaign staffers. Well, today, a group of mental health workers demanded raises too. WNCN's Bianca Spinoza was there.
That group of DHHS workers tried to hand-deliver a letter to Secretary Aldona Vos today. Problem was, she wasn't there, but instead, they marched into the doors anyway.
Mental health workers, Bill of Rights.
More than a dozen DHHS mental health workers gathered outside headquarters demanding raises. They say they're tired of upper-level management getting rewarded and mental health workers facing a wage freeze.
We're not asking for exuberant things, just a fair, decent, earn a living wage to take care of our families.
Right now, what we're waiting.
Things like that's all we want. That's all we want. Give us a seat at the table.
After the rally, healthcare technician Larcene Taylor walked into the main building to deliver a letter for Secretary Vos. She was stopped at the lobby, but did manage to get the letter to someone. Does a part of you fear losing your job by speaking out?
No, I've been in this union for 12 years. I've always spoken up. We are outraged over our governor and the secretary giving these exuberant raises to the staff members, cabinet members, when state workers have not had a raise, a decent raise since 2008. You take a 1.2% and they go up on insurance, that's nothing. We don't feel that you should give an $82,000 raise to 2 interns, no service to the system, just because they donated to your campaign, the governor's campaign. That's not
right.
fair. You got 10-year state workers. I'm a 21-year, 6-month employee of the state of North Carolina. You know, you're going to bring in somebody with 2 years, no experience, and get them up to $82,000? That's BS. It's not fair to the working people. I also want to say that our union has been pushing this Bill of Rights for a long time. And Representative Larry Bell has introduced a bill, House Bill 130, Mental Health Bill of Rights. We got to continue to push. Like I said, we're not asking for exuberant things. We're asking for basic human rights to be able to do the job that we were hired to do. And it's going to take continued pressure on this government, on our legislators, to get this job done. I like to personally thank all my co-workers from the different institutions that come out to testify on our behalf, because all of us together, that's the only way we're going to make a difference. And until they give us a seat at the table, we're going to keep dealing with the same stuff over and over again.
Good morning, and thanks to everybody for coming out today. I want to speak, first of all, on behalf of the mental health workers who are here with us today. I'm really pleased to see this group out. There's nothing like advocacy and for the workers to get out and demonstrate and do their own advocacy. Secretary Vos is adding a lot of people to her PR staff, and this is the PR staff for the workers, and I'm proud to stand with them today.
That's right.
These are the people who do the work with the patients. We do not pay them a living wage. We do not provide the training that they need in order to handle very difficult situations, and we have a zero-based policy. No problems, or it's the worker's fault, and often these situations are very dangerous. And so I speak not only on behalf of the workers, but on behalf of the patients that they take care of. The workers need adequate training. They need enough staff there that they're not put into dangerous situations, and they need a living wage. I think one of the most egregious decisions that we made last year was not to expand Medicaid.
Yes.
The state is, not only are we not providing health services for more than 300,000 people who would be newly covered, very sick people, but we gave up $16 billion over a period of 5 years and gave up 2,200 jobs. We need jobs in North Carolina. We need to be using the tax dollars that are going to the federal government from North Carolina need to be coming back into the state to provide services here and to help stimulate our economy.
Moment, I want to speak on the point of our grievance procedures that we have here in the state of North Carolina. It was already a few years ago. Our grievance procedures have been known as some of the strictest in the state of North Carolina when it comes to the staff filing grievances, and they had so many hurdles to jump over. In the U.S. justice system, you're considered innocent until proven guilty. But in the DHHS system, it's just the other way around. You're guilty until proven innocent.
You know what the teachers are going through. The teachers, they're losing tenure, and their salaries are cut. They have issues with the, they don't even have assistants like they used to have teachers' assistants. And you remember how you used to have the nursing aide. Everybody who's been in school knows there's a nurse's aide that you go to when you get sick. Well, they've even cut, Governor McCrory has even cut that.
I want to add to that when we talk about grievances and the state personnel. He tried to take it out of the office of hearing officer. We fought hard to keep that, and we fought because in the past we've burnt the state when it comes to handling some grievances. They spend a lot of money because they've had to reinstate workers. They had to give them back pay, you know. And they're gonna learn when you're dealing with UE. When we come to you with a grievance, we're not jiving. We got our facts. We got our ducks in a row. We know what we're talking about.
My name is Vicki Smith, and I work with Disability Rights North Carolina. And our responsibility or charge is to ensure that people with disabilities are safe and receive humane treatment and get the treatment they need. Where our concerns intersect with the workers' rights is that underpaid, overworked, exhausted, and poorly trained employees of facilities, that impacts direct patient care.
Most of the state workers are living in below poverty levels and are forced to work second jobs to provide enough income and support for their families to keep up with the ever-rising living costs. No matter how much seniority, after working on their jobs 5 to 10 years, 82% of our healthcare workers and technicians are stuck at the bottom of their salary grade, which is only about $25,000, and have not had a raise since 2008. The food and nutrition workers are paid even less and are required to wear hairnets, uniforms, special shoes.
Yes, I've been a nurse for over 50 years, and I have been in the mental health system for 30 years. I have worked for the state of North Carolina for 20. It brings tears to my eyes to feel that I'm still here fighting this fight. But I will tell you that over the last 20 years, there's been a steady erosion of the salaries, our job safety, job security, our benefits, and the satisfaction in our jobs. You didn't have to pay somebody $312,000 to come in and try and get recruitment. Today, as I walk through the hospital, I see people coming up to me and saying, I can't wait to get out. I'm going to take early retirement. I'm going to leave. These are the RNs. 46% of some of our RNs in the last, since 2012, have been saying they want to leave the hospital, and they have left the hospital.
And because the time is now that we raise attention to the workers of North Carolina, those who are making a way for North Carolina to continue to prosper.